So it's always difficult to talk last because a lot of people are gone, but the best ones are still here. And it's my great pleasure to welcome Caroline Bolling. She's a Brazilian sports physiotherapist, and she worked with elite athletes from diverse Olympic sports and was the head therapist for Cirque du Soleil. I know that she returns now a little bit to work with the Cirque du Soleil. And she completed her PhD at the Amsterdam UMC, giving voice to the elite athletes and artists regarding sports injury prevention. And I'm very much looking forward to hear what she has to say.
Thank you. Well, someone had to have the job to finish, and you are all survivors for staying here till now. And I'm going to talk about something that might not be totally related with the task that was assigned for me by Boris, because Boris came to me and said, is this one or this one? Is this one that I pass?
No, the black square one.
This one? Okay, perfect. So the assignment was that I need to talk about structure and function. And you can see how important we think sport and function, the structure and function is, because it is about what we can measure and visualize, and also what people are capable to do, and this ends up being the magic of health and performance. And this says a lot about our perspectives, because we think that structure and function are important. And when we talk about that, maybe we should think, so why I'm here to talk about the need to listen athletes and their voices. Beth Mead, which is an English football player, she's trying to explain that the fact that she has ACL, she knows a lot about what she's going through. And you can be a really good expert and know a lot about biomechanics and all. But by the end, the ones that are living with that are really the ones that know. And this brings me to the question, who is the real expert that we should be talking about? And usually, because we are really good in structure and function, we end up thinking that, no, I know what you're supposed to feel and do because I know a lot about your injury. And I think the next video, I don't know if we'll play. So this is Carly Simon giving us a good lesson. We think this song and this show, it's about us, don't we? Because the structure and function are quite important. So from now on, I will give you a few examples that I learned by talking with athletes and understanding their perspectives. So I will start with injury, and you probably know a few definitions of injury. And this one, it's the one used by the latest consensus of IOC. And you can see that has exactly the two things that we are talking about: structure and function, tissue damage, and something that changed normal physical function. And again, it is up to us to be able to measure that, right? But every time that we use numbers, and most of the times that we use numbers that try to count injuries, we consider the multiplicity of injury definitions. The main point is, most of our data, like OSTRC that is widely used, they are not measuring that. They are measuring perceived complaint, perceived need of medical attention, and perceived time loss. Because by the end, the athlete needs to perceive that they are injured and then report it. One of the studies that I conducted together with my colleagues was to really understand, okay, how do elite athletes, the ones going to the Olympics, so really high level, would define injury. And they start talking about symptoms. Yes, there is pain, there is discomfort. But by the end, what really matters is, does it hamper my performance? If it hampers the performance, they would consider themselves injured. If not, they would say, no, it's just pain. And then after that, the next point will be, but can I still play even if my performance is hampered? And they would. And then after that, some of them will say, can I manage? Can I reduce a bit training? Can I adapt my technique depending on the sport? They studied with multiple sports, so people would get different strategies. And then by the end, if they could not solve this by themselves, they finally would get to us, talk to coach or to the medical team. When they have injuries also matter. We did this study with the national team from Malta, male and female football players, and they say, if it's an important match, I don't care if I'm injured. I will give everything, even if I'm injured. So they will probably not even report. And in big surveillance systems, I love this paper. Australia has a long tradition with national surveillance systems of their athletes. And to be honest, the athletes just say, I lied a little bit, because I even don't know who has access to this data. If we go to rowing, and this paper was mentioned yesterday twice by Fiona and by Pete, culture changed the fact that someone will be willing to report injury or not. And we know that we are really good in putting everyone in the same package, despite the fact that we say that one size does not fit all. But our injury definitions also fit para-athletes. And this study, it's really nice from Christina Fager and her group, saying, well, it's really hard to even explain what it's an injury when you're already disabled. And we say those things, but by the end, we put people in the same pot all the time. We did a study with blind footballers, and we are trying to understand concussion. And believe it or not, a blind football player got the recommendation that should watch out for double vision. So what I'm saying here is that when we talk with athletes, you realize that injury definitions are quite of a mix. It can be sometimes I cannot perform my best. Sometimes can be there is not such a thing as injured or not. There are different levels, and this was one study that we did with professional dancers. Some of them say, I have pain, but I can keep going. Runners are really good with that. And some of them say, when I cannot adapt my training, that's my big problem. So I go back to the beautiful definition, full of structure and function. But to be honest, you can see that for the athletes, it's never black and white, which shows that injury, it is context dependent and even a dynamic concept, because the same symptoms sometimes will give one answer or one outcome, such as time loss or not. So this is injury from athlete's perspective. Let's jump to prevention, because we've been saying that prevention is more important. And we have a lot of evidence. We have a bunch of trials. And with those trials, some of the hamstring studies get to 70% of injury reduction, some ACL 60 plus. So we are good on that. But every evidence also has a context. We did a systematic review specific with football and non-contact injuries. And we put all the trials. And we have a lot of evidence. But if you look to this evidence, despite one study that was done in Nigeria, all the other studies are either European and North American. And we have an issue because, as I said, evidence has a context. Jump to the next problem. We've been trying to update a previous systematic review that we did, and this is all the trials related to injury prevention that we have so far. And you can see that we know a lot about little. By the end, we know a lot about North American and European. We know a lot about soccer. We know a lot about knee and some specific parts. We know a lot about male athletes, but by the end, we don't know about many of the other contexts. And that comes to, when we talk about trials, we are talking about causal claims. And the only thing that a good RCT can give you, it's the first causal claim. It works somewhere claims. So, which means the intervention A is able to deliver this outcome in that specific condition, usually highly controlled. And then we start to do studies with other contexts, and we get to capacity claim. So we start to understand that we can reproduce the similar thing in continue controlled environments. And by that, we assume that everyone is the same. So if I do this study with different populations, it's all the same. But then, the most important for us as clinicians is, does it work for me? It will work for us, in my condition, in my context. And the reality is, by the end, what we have is the patient that comes to us usually doesn't look like that one that we see in the trials. And with injury prevention, we start to say, you know what? There is things that work really well and proven to work, efficacy trials. But by the end, if you don't know the context that you should apply, then you have a big problem. And that starts to go, especially in injury prevention, when people start to say, you know what? The RCTs and the implementation need to kind of match. And this is the knee control study. And you can see that while in the RCT we got efficacy of 64, by the end, people need to use it right, needed to maintain, and by the end, this reduction in real life, it was around 12%. And when you go there and ask people what's going on, and they did this with the knee control study, people say, you know what? It's Sweden, it's cold, artificial turf. We need to make sure that the athletes is still warm, and we need to give training, and we have 75 minutes. We end up choosing few of the exercises. We don't care much about quality. So the way that, and this is all about specific exercise-based interventions. And in one of my studies, I went to Cirque du Soleil artists, and I asked them, what do you think about injury prevention? And I love the quote of this artist that say, it's not about one exercise. If you are healthy, if you eat well healthy, your body will be healthy. It's mindset. And I love the sentence, an exercise will not change your life. It's a lot of stuff. In this study, what we did is we went there and we started to ask the artists what they believe would be influencing injury. And there's supposed to be a video. And what we saw is that there was many factors that they were mentioning. So it would be load, but then there is physical load, mental load, social load. And then with that, they kept saying, but then this person is responsible to deliver this. So it was becoming bigger and bigger when we talk with them. By the end, I tried to organize this, and you can see that the interesting part is there is some factors that we know, especially around the artist, that we know really well. It's around function, right? So you can see that we have strength condition, we have movement quality. But I would like you to pay attention to the out circle, the blue one. And those are all the stakeholders that were mentioned to be interfering in some of those factors. So it makes sense that one exercise will not change my life because it's a lot of stuff. If we translate this to sport, then we need to look, for instance, to the big system that we have, for instance, with elite sport. And we are just that tiny bit there, health professionals, taking care of the athlete. But there is a lot around there. There is scientists, there is the coach, there is the physical performance, training, conditioning, and we need to work with them. And in another study, I went to talk with snow sports athletes, and they start to say, why are you talking about injury prevention? I use a tiny suit and I go down on the slope in incredible speed. Do you really think I am preventing injuries here? And they said by the end, what they do, it's called risk management. And they said they read a full amount of information when they're going down, but there is a lot of, again, stakeholders that are important to be considered there, including the audience, because they said, you know what? We don't want a race to be canceled because we're going to hear all the booing and all, and they are there for the show that we deliver in alpine skiing, for instance. And what we see is that they are going down, and they say that they have this kind of angel and devil in the back of their minds, and this is an expression that a coach heard from an athlete. And this devil say, go, you can keep pushing, and the angels say, no, we cannot do this, not at that speed, slow down. So in that specific scenario, they say that injury prevention, it's really about this mental equation that they all the time think about athlete factors. So am I strong enough and I'm mentally focused today? Oh, I have this back pain that has been bothering me. Or, oh, the visibility is really bad. There's no condition, it's not ideal. I've been here before. I know exactly what I should do with this learning because I have this learning process, so I know how to deal with that. Some of them said, well, there is the nature of sport. Sometimes you need to do the most difficult tricks because you want to deliver the show. And they also consider, like, I have a full team behind me to support me, but also to push me to do my stuff. And in this case, you can clearly see that injury prevention, it's really about this decision-making process. If we move to another sport, women's football, and this study, I interview athletes, coaches, and physios about injury prevention in the highest level of European women's football. And they said, to be honest, the reality right now, it's amazing. But they came from a reality that they used to study and or work. They trained 9:30 p.m., finish at 1 a.m., and at 8 a.m. they were working again. And then they say, well, look at this now. I am living with football all the time. I have people to help me all the time. It sounds like perfect condition to do injury prevention. So even the same athlete will have different needs and strategies in different moments. A similar finding we had when we interview, for instance, Belgian athletes from different sports. They say, you know, what I needed when I start my career and what I need right now for injury prevention is completely different. And they mention that this development journey that they have of their career was based mostly because they were exposed, for instance, with sports culture. So, for instance, no pain, no gain culture, it's something that influenced that. They also get injured, and in many of the studies that we talk with athletes, they say, well, the thing that most influenced the fact that I want to do injury prevention, it's because I had a previous injury. They talk about the ability to work with team and with different professionals that kind of also influence their injury prevention, and the full structure that they have later on, but not in their early career. And then they say all that influence their injury prevention process. So you can see that injury prevention, while we think that we are really important with our exercise-based interventions, it is about many things. And when we talk about athletes, we get the idea that, to be honest, we need to listen and work with many stakeholders and understand all the needs that they have, including in different moments. And now we're going to get to return to sports. That is a topic that we heard a few times here. And I think we also listened a few times that our patient, it's not an average. But if we look to return to sport, we get rates. And this is like just one study that say, well, an amount of athletes return or do not return to sport. And usually we blame on clinical outcomes for returning or not returning. Again, our vanity, Carly Simon, could say, Because we love to say that this is my piece of cake. This is what I understand. And especially with return to sports, we do that all the time. We say, okay, this is the part to rehab this, so it's mine. This is the surgeon part. And what we saw when we talk with athletes, it's that they, unfortunately, are the only one that need to deal with the full cake. When we start to interview people from different backgrounds and expertise, they share this process in different ways. So sometimes the surgeons say, well, there is the surgery, there is the pre-op, there is the surgery, there is the post-op, there is rehab, and then they return. If you go to the physio, they might split in different phases of the rehab. If you go to the strength and conditioning, they say about other phases. And then by the end, what we have is an athlete that feels completely lost. And one of these studies that I've been doing, it's like following athletes during their journey to return to sport. And I get quotes like that. I was practically in tears because I had a lot of mixed messages. This athlete was trying to go to the Olympics in Paris. And she said, well, I don't feel I have enough guidance. She was playing the role of mediator between sports people and the doctor. She says, well, the coach doesn't know where I am right now and just say, hey, go train. And meanwhile, the surgeon said, well, you can train again. So it was not very clear. And for this athlete, all that she said was like, it's really frustrating. So communication, it's a key component for return to sport. And we saw that also specific in snow sports when we did one of these studies. And I love the quote of this athlete that said, who is coordinating everything? We need to make sure that everyone know the work of everyone. And it was interesting because this was an experienced athlete and said, I am happy to be the one. But if it's someone young, who's going to coordinate that? And then an athlete will end up being the mediator. So for return to sport, we can understand that it's a full process, that there is a lot of milestones and criteria. Yes, there is multiple resources, multiple experts, but by the end, we need to remember that this is supposed to be about that one athlete. And what if the athlete doesn't want to return? Are we good on that? Because we always think that it's just about us. So if I give back the structure again and reconstruct ACL and bring back your function, well, one of the athletes of this study that I was conducting decided to stop her career. And you can see that the quote is quite strong. I know in my heart I don't want to stop, but I know in my mind that it's the best for my body. I don't want to feel pain in my life anymore. That's a clear decision of an athlete. And by the end, many of the people were just saying, you know, keep pushing. And then other thing that we love to say about the structure and all, we can meet all the milestones, we can do all that. But by the end, the ecosystem around the athletes, it's huge. This athlete, she was 9 months after ACL, ready to come back. And she said, you know, it's a lot. There is fans, there is the reports. The team was doing really well. So the team standings, like, they don't need me right now. And if I go back, it will be difficult for everyone to deal with that. Imagine me benching an Olympic medalist. Probably will be really difficult. And all that influence decision-making and putting this athlete back. So I know that I'm supposed to talk about structure and function, Boris. But I think the good reminder here is we can be really good on that, and we need to have all the knowledge about. But we should never forget all the layers, that knee belongs to the athlete, that this athlete plays a specific sport, in a specific association, in a specific country. So we need to get all the layers of this athlete. And then you might say, okay, but how do I get there? Well, if you think about the diversity of athletes that we end up working with, I'm talking here about research, but most of us are clinicians. We do that really well. We talk with them. They are the ones that will say, this influenced my injury, this influenced my intervention. And it is about talking with them. Just a good reminder, this song, it's not about us. This song, it's about them. So what we need to do is listen, involve, let them show the way, let them make decisions, and also explore their own perspectives. If I don't know enough, ask and learn more about context. And then in the end, it's really about leaving our vanity alone and then be bold, be open, and try to build solutions together. Thank you.